This meeting has been very exciting because of the fact that we have a lot of bispecifics. So I presented the MagnetisMM-1 data, which was the first in human study using Elranatamab in relapsed refractory myeloma. Elran is a bispecific T-cell engager targeting BCMA, activating T-cells as well. And what we presented was data on 55 patients once they'd reached a dose which has been used in the phase 2 recommended dose. What we found here was in these 55 patients a pretty high response rate. These were extremely heavily pretreated with a median line of 5 lines of treatment. They'd all seen a PI, an IMiD, and a CD38 antibody. And the interesting thing about MagnetisMM-1 was we allowed for prior BCMA. So we had about 22% of these patients who had prior BCMA. It could have been a CAR T-cell or it could have been an antibody drug conjugate. Overall, the response rate in this 55 patient cohort was about 62%, and we did see responses even in patients who had prior BCMA, albeit a little bit lower. It was about 54%, and we saw that the duration of response in the responders was about 17 months, with a CR and a complete CR rate of stringent CR rate of approximately 38%. And a lot of these patients who achieved a stringent CR were MRD negative when we tested for MRD negativity. This translated into a progression-free survival of close to 11.5 months, which is quite remarkable in this heavily pretreated patients. Toxicity-wise, extremely well tolerated. The expected toxicity of CRS was seen. Most of the CRS was grade 1 and grade 2 and easy to manage, and most of the other toxicities were hematologic but easy to manage with supportive care.